وما أرسلنا قبلك إلا رجالا نوحي إليهم فاسألوا أهل الذكر إن كنتم لا تعلمون.
بسم الله الحمد لله والصلاة والسلام على رسول الله أما بعد. I would like to welcome you to this discussion, which has been arranged on request of the brothers at Cricklewood Muslim Youth Trust in order to raise awareness amongst the community in relation to COVID-19 and to answer some questions in relation to this. Today is the 25th of Jumad Thani in the year 1442 Hijri, which coincides with the 7th of February 2021. My name is Haider Khawajah. I am a junior doctor, originally from London. However, I'm currently doing my foundation training in the West Midlands. I am very kindly joined today by our brother, Dr. Mazhar Choudry, who graduated in 1991 as a doctor. He is a respiratory consultant in the West Midlands, and so he is a specialist in in lung conditions, and he's on the front line dealing with the COVID-19 pandemic day in and day out. So, assalamu alaikum wa rahmatullahi wa barakatuh, Brother Mazhar. Jazakallah khair for joining us and giving your time today. We are also joined by our brother Ziad from Cricklewood Muslim Youth Trust, who will be leading this discussion and going through some of the questions which have been sent in and collated by the community at CMYT. So without further ado, I'll hand it over to our brother Ziad to commence, inshallah. Bismillah.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Now, so we've had some questions and some concerns raised by our community and by the Masjid itself, just with regards to the COVID-19 pandemic and other concerns that have come up. So just as a brief introduction, what exactly is COVID-19 in layman's terms, and how does it infect someone, and how is it transmitted?
Okay, Jazakallah khair. COVID-19 is a novel coronavirus which was discovered in Wuhan in China in December 2019. Now, prior to that, there have been lots and lots of different coronaviruses. There's probably hundreds or thousands of them, and we've known about them for decades. This was a completely novel virus which we've never seen before, and it spreads by droplets. So when people talk and a little bit of spit come out, or sneezing, coughing, etc., and so you get droplet spread from one person to the other. It can also be spread in the air, so you get very tiny particles that spread in the air, and it's also thought it can spread by contaminated surfaces like door handles.
Jazakallah khair. And there are some who, for example, they think that if you don't have a cough, then you don't have COVID-19. Can you briefly explain what are the main symptoms and also those less common symptoms?
Okay, so there's a very wide range of symptoms. Most people will have fever or cough or loss of smell or taste, but not everybody has cough. More serious symptoms that we see are people who get very short of breath, or they may have chest pain or chest tightness. People have diarrhea, vomiting, muscle pains, fatigue. They feel very tired. They feel very lethargic. They may have fever. So these are the sort of main symptoms that we see.
Okay, and we often hear that coronavirus and the flu are the same. Are they the same, or is there any difference between them?
So they're completely different. So flu is the influenza virus, which we've known about for hundreds of years. Many people have been talking about Spanish flu, which was a flu epidemic immediately after the First World War, which killed between 50 and 100 million people. But more commonly, we have the flu every year, which kills several thousand people, particularly frail elderly people. But this virus is a completely different family of viruses from the flu. So completely different. The only thing they share in common is that they're both viruses.
Okay, and are there any particular groups that are at more risk with the coronavirus, and why? And is it only people with underlying health conditions who are at risk of serious illness or death? What are the risks, for, if there is any, and is it still dangerous for someone who is healthy?
Okay, that's a very good question. So the majority of people, about 3/4 of the people who've died from coronavirus have been elderly patients, people in the sort of late 70s and 80s. So they're the highest risk group, which is why they've been told to shield from the beginning to protect them. But they're not the only ones who are at risk. So you've got people with any sort of chronic disease, whether it's chronic kidney disease, heart disease, lung disease, people who are diabetic, people who are on immunosuppressants like drugs like steroids and other sort of drugs to damp down their immune system because they have some sort of inflammatory disease. So as an example, somebody who might have, say, rheumatoid arthritis, they're on these powerful drugs that suppress their immune system to suppress the arthritis, but it makes them vulnerable to catching infections. Or people who are immunocompromised, which means their own immune system is impaired. So these kind of people are all at risk. But what we found recently, and this has been my experience with this second sort of peak that we've seen in the last 2 or 3 months, is that we're seeing a lot of younger patients coming in. So a lot of my patients are in their 40s and 50s, and they have no or hardly any underlying sort of problems. And it seems to be, and we've also had sort of in some cases people in their 20s and 30s getting very sick. So it's impossible to predict how any particular individual is going to cope if they're exposed to coronavirus.
Okay, and we know you've been working, with the coronavirus patients since the beginning of the pandemic, day in, day out within the hospitals. So what can you shed some light on what can someone expect coming into hospital with COVID-19, and why might someone need oxygen or need intensive care?
Okay, if somebody's poorly enough to come, so most people should be managed at home. So usual things like bed rest, plenty of fluids, paracetamol, ibuprofen, those kind of things for the majority of people. But if people are very poorly because they're having lots of diarrhea, for instance, or they can't breathe, then they should first of all call 111. If necessary, get an ambulance and go into hospital. So when you come into hospital, we try and cohort people. So people who have got a history that's suggestive of coronavirus, we try and keep them separate, completely separate from people who we don't think have got coronavirus, because obviously otherwise the disease will spread throughout the hospital. So to prevent people going into hospital without coronavirus and then catching it. So when they come in, the first thing they'll have is a swab. Sometimes you can get urgent swabs, which give you a result in a couple of hours. More often you'll have the swab done and you'll get an answer in 24 hours. You'll be seen by a team of doctors. They'll do observations, they'll do blood tests, get a chest x-ray, maybe put up a drip, give some fluids, they'll take a history and examine you, and then they'll decide how seriously, whether you're seriously ill or not. And if somebody's quite mild, so all their numbers, their blood pressure, temperature, pulse, their oxygen levels are fine, then quite often we can send them home and just advise the general measures that I've mentioned a few seconds ago. If they're poorly, so if their oxygen sats are low, so when we talk about oxygen saturation, we use something called a pulse oximeter, which is a little device that you put on the finger, or sometimes you can put it on the ear, and it measures two things. It measures your pulse rate, which is how fast your heart's beating, and it also measures your oxygen levels. So the normal oxygen range in people who are healthy is between 94 and 98%. So if it's below that, below 94, well, certainly below 92%, then they will need oxygen. So what we're doing in my hospital, and I think in most places, if somebody's oxygen level is less than 92%, we're giving them oxygen. Some people need less oxygen, and you'd run them at a lower level. So people who've got COPD, so COPD stands for chronic obstructive pulmonary disease, basically what we used to call chronic bronchitis or emphysema. And so these are people who used to smoke, and their oxygen levels naturally a bit lower. So we run those people at a slightly lower level. But for the most part, the majority of patients we're managing, we're trying to get their oxygen level above 92%. So if somebody comes in, oxygen levels are low, and they've got there's this characteristic fluffy shadowing you see on a chest x-ray, which is very suggestive of COVID pneumonia or COVID pneumonitis, as we call it. So we tend to treat them with antibiotics. We give them high-dose steroids. We give them an antiviral called remdesivir. And if they're very ill, more recently we've given them a new drug called tocilizumab, which is also an anti-inflammatory drug. So those are the main treatments. We start off with the lowest level of oxygen we need. So that you can understand, we who are not on oxygen are breathing in 21% oxygen. So 21% is the amount of oxygen in the air. Some of these patients are going to need 40%. So if they're on 40% oxygen and they're starting to struggle, we put them on a special mask called CPAP, which blows the air down. So it forces the air down to keep the bronchial tubes open and stop them collapsing. And on top of that, we give them oxygen. If that doesn't work, we may need to send them to intensive care, and they may need to put them to sleep and put a tube down into the throat and connect them up to a machine which will help them breathe. But that's only in extreme cases.
Okay, and how about what we hear of as long COVID? Is there anything that can help with those symptoms?
I don't know really, to be honest. It's very early days. I think long COVID is defined as having symptoms beyond 12 weeks, beyond 3 months. I think up to 10% of people will have long-term symptoms. So fatigue, trouble breathing. They may have something called brain fog, where they can't think clearly. There's lots of other different symptoms as well. Lack of energy, muscle pains. And so it's very early days in terms of treating those. We don't know what the treatments are. Some people are suggesting that so when somebody comes in with COVID pneumonitis, they get steroids for 10 days. We only give steroids to people who need oxygen, otherwise they don't get steroids. Some of those people may need to have longer courses of steroids. If somebody has COVID but they don't need oxygen, really there isn't any other treatment so far that we know of. So I think it's going to be symptomatic things, painkillers, things like that. It really is early days with respect to COVID-19, with respect to long COVID.
Okay, and if someone has COVID-19 or suspects that they do, what should they do initially? For example, we've heard of those who think that so long as they go out and wear a mask, it's safe for them to go out and go to the shops. What's your advice regarding this?
Well, no, they need to go onto the government website if they have him, and they need to isolate. It used to be 14 days. I think it's 10 days now. They need to test. If they're worried about themselves, they should ring 111. If they're very worried, 999. But they need to isolate. So a mask is good. A mask reduces spread, but if you think you've got COVID, then the only way to stop it spreading is by isolating. The only surefire way of stopping spreading is by isolating yourself. Because even if you wear a mask, I mean, how long is it going to work for? I mean, are you always going to cover your nose? Are you going to pull it down? So even with the mask, there may be risk of spreading to other people.
Okay, and so personal question to you. What is your own personal frontline experience with dealing with the COVID patients?
This has been a really difficult time. So this second spike has been worse than the first one. We've had a lot more cases. We've had a lot more deaths. And not only in the first wave, what we did was we cancelled all elective surgery and clinics and everything, so that everybody could concentrate on COVID-19. So everything else, apart from sort of urgent things like cancer operations or emergency operations. So, for example, somebody comes in because they've fallen and fractured the hip, so they need an emergency operation. Apart from the emergency stuff and the cancer stuff, we cancelled everything so that everybody could concentrate on COVID. And we had a lot of people come in, die very quickly, despite our treatment, particularly elderly patients. The second time has been more difficult because it's been a prolonged spike. So we're looking at sort of from November. It was really bad in January, February, because we were getting sort of after in the beginning of January, after Christmas and New Year, we were getting up to in fact in excess of 60,000 new cases a day. I think we dipped below 20,000, but people are still coming in. So we basically got hammered with loads and loads of patients coming in. But not only were they COVID, all the other stuff where people come in because they've got heart disease or the diabetes is playing up or they've got chest infection. So we had to cope with all of that stuff. So the NHS was very, very close to breaking point. In fact, in London, they had to ship people out. So I think they were sending people up to Leeds and to the West Country because they were running out of ICU beds. So it was a really horrendous situation. I've been working in the NHS nearly 30 years, and I've never ever seen anything as difficult as the time that we've gone through in the last few months. So it's been very difficult, been very stressful. We know of colleagues who've died. I personally, personally know of people who died early on, not directly, but one of my colleagues, her first cousin died. So we've never been in a position before where we as healthcare professionals were fearing for our own lives. And subsequently, we've seen that thousands of doctors, nurses around the world have died from this. So it's been, I think there's going to be a lot of PTSD once this finishes. There's going to be a lot of mental health problems. And I think it's going to be worse with nurses and doctors because they wear PPE. They do a 12-hour shift and they wear PPE for 11 hours. They get very close to the patients. So you can have a patient who they've been looking after for days on end, and suddenly that patient deteriorates and dies. So that's enormously stressful and traumatic for the nurses, more so than for the doctors, because the nurses are looking after a particular number of patients, whereas we're moving around seeing lots of different patients and only spending a short period of time with each one. So it's much worse for them. So yeah, it's been a very difficult situation, very challenging. Alhamdulillah, I think we were fearing worse. It has been terrible, but alhamdulillah, now things are, with this lockdown over the last 5 weeks, things are slowly improving. But the fear is, as soon as you release the lockdown, we're going to surge again.
Okay, so just in addition to what you've just said, to relate to that, what's your response as doctors to those who claim that the NHS is not under strain and that the hospitals are actually empty and that the current UK death toll is the same as it usually is for this time of the year?
Okay, so what I would say is that the NHS is always under strain. For the last 10 years, particularly in the winter months, we've always had trouble. We've always managed somehow, but we've always been very close to the point where we've run out of beds. But this year, the only reason, this year has been terrible. This year has been much worse than previous years. And the reason we've coped is that, for example, intensive care, what we've used is operating theatre space and making that intensive care. So our intensive care capacity has gone up massively. The reason the hospitals seem quiet is because, as I said, we've cancelled clinics. So the normal hustle and bustle, you see people coming in clinics and coming in for operations. We've cancelled that because the NHS, as I said, it's a breaking point. We can't take extra stress. We've had to just concentrate on COVID-19. As an example, say somebody comes in for a routine operation. Sometimes routine operations, particularly a big operation, can go wrong, or the patient needs to spend a couple of days in intensive care. Well, it's better to try and avoid that kind of surgery, because intensive care, as I said, is a breaking point. All those anaesthetists who would normally be involved in putting people to sleep during operations have been involved in intensive care. So people who practice intensive care and anaesthetists, they come from the same sort of background. So we have redeployed all our anaesthetists to become intensive care doctors. And if we'd had all that routine stuff, the NHS would definitely have broken. So it may look like it's quiet, but the reality is there are certain areas which are at breaking point, and if the other areas had been doing normal activity, then the NHS would definitely have collapsed.
Okay, so, also, what's your advice to those who believe that as minorities, if they come into hospital, that they will be more likely to receive poor treatment or perhaps even die in the hospitals due to them being of a minority or even a language barrier? What's your advice regarding this?
Well, BAME are more likely to die, but that's not because of lack of treatment in the NHS. For example, people coming from my background, Pakistani background, or Indian, or a Bengali, Arab, we're much more likely to have diabetes. People coming from an Afro-Caribbean background are much more likely to have high blood pressure. These are two big risk factors for getting COVID pneumonitis, or having a bad prognosis, and also being obese. And unfortunately, obesity is a big problem in our community because of eating and lack of exercise. So we do badly. There's no doubt about that. There's also lots of other factors because of multi-generational living. So you get grandparents, parents, and kids all living in one house. Our community is generally poor, so we live in small, cramped houses where it's very easy for the virus to spread. People do gig economy jobs, so they're sort of taxi drivers, or they work in restaurants, so they don't have the luxury of being furloughed like middle-class white-collar workers, so they can stay at home and work from home. These are people who have to go out, and if they don't go out, they don't earn any money. So these are the factors why our sort of BAME communities do badly. It's not because they get treated badly in the NHS. And I can say that with a lot of confidence, and I'm sure Haider would agree with me, particularly, for example, you're in London, we're in the West Midlands, we are hugely overrepresented, alhamdulillah, in the NHS in terms of doctors, nurses, pharmacists. So people coming from, non sort of Caucasian, non-English sort of heritage backgrounds. So I don't think that's a problem. I don't think there's this bias against BAME individuals. I do think, and I've always had this feeling myself, that if you don't speak the language of the country, you disadvantage yourself. So, for example, if I'm going around and me and Haider are doing a ward round, we go to see a patient, and let's say for sake of argument, that patient comes from somewhere in Africa, or they come from somewhere in Eastern Europe, and they don't speak English, and me and Haider, we don't speak their language. Naturally, they're going to lose, something's going to be lost in communication, because you become very dependent on the relatives who you can't always access, and also interpreters who can be difficult to get hold of. So as a general thing, for example, myself, if I went and lived in Spain, for instance, I would be at a disadvantage if I didn't speak the language. So this is a general phenomenon. So I think that holds true, but I don't think it's a racism-based thing.
Yeah, I'll definitely agree on that. In my time as a doctor, I can honestly say I've not seen any patient treated any differently based on their or ethnic background.
Yeah, that's a really good insight. So what would you say also to those who, they don't want to come into hospital of fear of either catching COVID or being a burden to the NHS?
Well, I would say is that if you can manage at home, then stay at home, because as I said, the NHS is overburdened. But if you need help, you should go in. So this NHS belongs to all of us. Everybody has a right to use it. Nobody should abuse it. But if somebody's feeling poorly and they need to go in and they need to get treated, then they should go and get the treatment because it is their right. Having said that, there's never zero risk. So if you go into hospital and you don't have COVID, because people like myself, I've had COVID. I had it in October and gave it to my family, and lots of my colleagues have had COVID. It's very difficult to work in an environment like a hospital, no matter how much you clean your hands, wash your hands, clean your stethoscope, wear mask, wear PPE. It's still possible to get COVID-19. So I would say if you need the treatment, go into hospital. But if you don't need the treatment, stay at home. Because even if you go into hospital, even with the best will in the world, there is still a potential risk of somebody catching it in hospital.
Okay. Many people also have not been taking this virus seriously due to those online who are spreading doubts amongst the communities that COVID-19 is a hoax and that the government just want to control us and that the doctors themselves are actually deceiving the people. What is your response on this?
Yeah, this is deeply offensive and very hurtful because, as I said, I've been practicing for a long time, and Haider will have this experience, although he's new. As a Muslim doctor, you often get calls from brothers, even late in the evening when you're not working, and people ask you for your advice and they trust you. So why people could trust you for 20 plus years and suddenly they say, it's like somebody's flicked a switch and said, no, we can't trust these people anymore. I mean, this is like a big slander and we're talking tens of thousands of Muslim. If you don't trust the non-Muslims, that's one thing. But we're talking about tens of thousands of Muslim healthcare professionals, many of them practicing Muslims, that for this to be a massive collusion, nobody with any intellect would really believe that we've all got together and that we're all going to harm our patients for the sake of some government agenda, or ridiculous stuff that we're on Bill Gates' payroll, or that we're injecting putting microchips into you. This is complete utter garbage, and anybody with an akal shouldn't entertain this. And they should not think this. We've gone into this profession because, inshallah, we'll get reward and we'll make a difference. And we know, as Allah says in Quran, that whoever saves one life, it's as if he saved all of mankind. So, inshallah, this is something that motivates us. We are not practicing medicine to cause harm to people. So this is a ridiculous notion.
Yeah, but I mean, personally to you, how does it feel for you personally that you are working under strain in the hospitals? I mean, working directly with the COVID patients, you're seeing day in, day out how much of a reality this virus is. And there are people downplaying your efforts and saying that all of this is just an act.
It's very frustrating and it's deeply offensive. And those people, it makes me very angry because those people are endangering other people. Because you see people coming in, you see they're fighting for the breath, and you see one thing, and I'm sure Haider will agree with me on this, is one thing that I see with this that perhaps I haven't seen before is the fear in the patient's eyes. People are very fearful. So people who, maybe they're a little bit overweight and they didn't exercise, but they've never really had any health problems. They're working full time. So these are people who've got families, busy lives, and suddenly they're fighting for breath. They can't even talk without getting breathless. So, by belittling our efforts and casting aspersion and suspicion upon us, people are going to start thinking, well, COVID isn't real, it's a hoax, so they don't take the precautions. But then the people who are relatively healthy like this, they can come in and they can be at death's door. So it's deeply, deeply irresponsible.
Yeah.
May I just add one thing again? I think anyone who's spreading these kind of things just needs to keep in mind, as Mazhar mentioned, that 40-year-old or that 45-year-old who previously is fit and well, and then we're seeing them coming to hospital and they're struggling for breath. It's not, it's not pleasant for them. It's difficult to see. I mean, if you can just keep that one thing in mind of someone not being able to breathe, like imagine you tried to hold your breath for 2 minutes or something. It's not pleasant. And we weren't just seeing random 40-year-olds come into hospital before that. And I'm sure Mazhar he's got 30 years experience now. We never used to just see 40-year-olds come into hospital short of the breath for no apparent reason. So, may Allah subhanahu wa ta'ala raise this test and curse from us.
Ameen.
And grant us all guidance and tawfiq to do that which is correct.
Ameen.
I mean, just to move on to the next question. So there are many people who have put themselves forward online to speak about the COVID-19 situation, which I'm sure you're aware of. Some of them may even be university qualified in science or biochemistry. However, what actually makes someone qualified to speak about the COVID-19 and issue advice regarding it?
Okay, that's a very good point, Aki. So people who should be speaking about this are people who, so for example, in terms of treatment, people are involved in the management of this. So for example, GPs, ourselves, hospital doctors who are seeing it all the time. And in terms of the vaccines itself, the companies that are making the vaccines and the scientists who are involved, like Chief Medical Officer, people like Fauci in America, people who have decades of experience in this. Not just they've got a BSc or a PhD in an unrelated subject. Having a PhD in something does not qualify one to speak on this. Even doctors who I work with, so for example, if I talk about a knee surgeon, for instance, he's an expert in his field, but he's not an expert in COVID-19. And similarly, if somebody is, let's say, an eye specialist, he's an expert. He may even be a world expert in eye diseases, but he's not an expert in this. And what will happen with these people, they will speak generally, but they will sort of defer to someone like me for more complicated issues about this subject. So they might say to me, right, Mazhar, look, I'm an eye surgeon, but it's not really my field. You're better qualified to speak about it, even though they have got medical training. So personally, I think it's extremely deluded and arrogant for people if they've got a degree, BSc, master's, PhD, postdoc, doesn't matter what. If they've got it in a science subject, I mean, science is an ocean. We're talking an ocean. For them to speak on this subject without expert knowledge, this is it's fraudulent, and it's disingenuous, it's dishonest, and it's really out of order.
Would it be correct to say that in order to speak about this matter, you need to have field experience and actually be working in that field, rather than just having textbook knowledge or a university certificate?
Of course, Aki. Of course, you need to be, even in medicine, right? And I'm sure as Haider will appreciate this. You do 5 years or 6 years doing a medical degree, but you only really start learning from the first day you start working, okay? Because you're taught. But when you're actually doing and applying that knowledge, it's about application of your knowledge. Okay, it's very easy for people to sit on a keyboard on social media and make out they're an expert. Okay, but people who've done it, they think before they speak. Okay, because they know that their words will have an impact. Okay, it's very easy to speak without any sort of knowledge. And as I'm sure Haider will testify, once you actually start working, you realize that it's very deep, and you actually realize how little you know once you start practicing. And I can say that, very truthfully, that despite working for decades, there's so much that I don't know. Outside of my own field, I think I'm okay in my field, but medicine is an ocean. So people who aren't even working in it, they really shouldn't speak about it.
Yeah, I totally agree with the point of practicing is so much different to when you're at university. As I said, I'm doing my foundation training, so I'm a registered CMYT Doctor. and literally day one, you realize it's a huge step up from, doing with the textbook or even just practicing amongst colleagues and students when you're actually put in a position of responsibility where you have to make decisions about patients. It's a huge step up, and experience plays a huge part in becoming a better doctor.
Jazakallah khair. So the next few questions that we've got are concerning the COVID-19 vaccines. So the first one we've got is, how should we as a community advise and educate people who have concerns about vaccination and immunization?
There's been a lot of heat but not much light on social media about the vaccination. Now, in the UK, 12 million people have now had the vaccine. Okay, so just over 1 in 6 people have had the vaccine. Over 500,000 have had both doses, and there have been very, very few adverse effects. Okay, and there's so many studies coming out every day. There's new studies coming out showing the benefits of these vaccines in terms of reducing the spread of COVID-19. We have the main ones in the UK are Pfizer and the AstraZeneca Oxford vaccine, and so they both have their sort of strengths and weaknesses. For COVID-19, essentially, you have to weigh up the harm and the risk. The harm of having these vaccines is very small. The harm and the benefit, but the benefit massively outweighs any potential harm. So I think it's very, very, very important that people go and get their vaccine. Can I just say that also this has been, if you look at, say, for example, Sheikh Saleh Ali Sheikh, the Grand Mufti of Saudi Arabia, he said that this is one of the blessings. This is a blessing from the blessings of Allah. Yeah, and so if very, kibar ulama are endorsing it, the medical profession is endorsing it. Yeah. Inshallah, the people have nothing to fear from it.
Definitely, and many people believe that the COVID-19 vaccine, it contains harmful substances such as aborted human fetuses, animal tissues from pigs and other animals. And they also say that the vaccine is a poisoning of the blood and nervous system. Is there any truth to this?
None whatsoever. There are no animal products. There are no aborted fetuses. And as I said, 12 million people have already had these vaccines. This is in the UK alone. Millions more worldwide. And we've in many cases, quite a few months have elapsed now, and we are not seeing any sort of neurological phenomenon in these patients.
Okay, so it wouldn't poison your blood or nervous system?
No. See, what happens is these things go through in America, they go through the FDA, and here in the UK through the MHRA. These are the regulatory bodies for new medication, and their testing is extremely rigorous. They are not going to allow stuff to be given to millions of people. Even if it's a drug that's given to a handful of people, the drugs are rigorously tested before they're released onto the market. So the process is very, very stringent.
So how about those who, maybe have gone through an allergic reaction to the vaccine?
Okay, so they've been as far as I know, there were a couple of cases of allergy with people with the Pfizer vaccine. Okay, my understanding is that the people can have the vaccine even if they have a history of allergy. So, for example, as an example, my dad is allergic to penicillin. Okay, but he had the vaccine 3 or 4 weeks ago, no problem. I think it's people who have like peanut allergy and they have to carry something called an EpiPen, an adrenaline, like a pen that you stab into your leg to release adrenaline if you get what's called an anaphylaxis. Anaphylaxis is where you come out in a rash and your throat closes up and your tongue starts to swell. That's an extreme allergic reaction. Even those people are being encouraged to have the vaccine as long as they're not allergic to any of the individual ingredients of the vaccine.
Okay, there's also been concerns with regards to their severe side effects. Is there anything we should be concerned about the side effects of the vaccine?
Okay, so I think it's quite common for people to get side effects after the vaccine in the sense that, but self-limiting. So just for a day or 2 days, occasionally 3 days, they may have pain, they may have a bit of swelling at the injection site, they may have fever, they may have some mild symptoms, sort of feeling lethargic, feeling a bit under the weather, but these symptoms don't last long. Okay, so in terms of sort of continuous, permanent symptoms, unresolving symptoms, I haven't seen myself any evidence of that in looking at the sort of medical literature.
Okay,
there is a video going around of somebody, and he talks about, he went on the CDC website, and there was 100,000 cases, and he said 3,000 people had irreversible side effects, which is completely untrue. 3,000 people may have had a temporary symptom, but nobody had irreversible side effects. So that's patently untrue.
Okay, and just as we get to our final questions, just to show the reality to our community, what is the numbers of death nowadays in comparison to before? Is there any difference since the beginning of the pandemic?
Okay, yeah. So if you look at the figures published by the Office of National Statistics, so people can go and look this up for themselves. On average, 10,000 people died in the UK per week over a 5-year period from 2015 to 2019. So on average, 10,000 people die a week. Okay, there was a surge in April last year where it was 25,000 people dying a week. So there was definitely increased excess mortality. Okay, so we've had 110,000 people dying of COVID since since the beginning. I think since February last year. So in less than 12 months, we've had at least 110,000 people die because of COVID, and probably another 15,000 excess deaths due to people who had other problems and couldn't get treated or couldn't get treated in time, because all of our efforts were being concentrated on combating COVID-19.
Okay, so we can confirm that the hospitals are indeed not actually empty as people are claiming.
They're not at all empty. They're not at all empty. As I said, the beds that would be filled with people who are going in for elective surgery. So somebody goes for, I don't know, a gallbladder operation or something. Those operations aren't happening, so those people aren't in hospital beds. Okay, so there may be some free beds on certain wards, but the wards where the COVID-19 patients are under unbelievable pressure. January was horrific on our ward. There were so many sick patients. It was like an extended, instead of being a normal ward, it was like an extended intensive care ward. And alhamdulillah, things have improved because of the lockdown. So temporarily things are getting better, but still today, I've been on call this weekend, still people are coming in with COVID-19 and still they're needing extra treatment. So yeah, this thing about the wards being empty, it's just another one of these nonsensical arguments.
Yeah, I was asking you that because there was a video circulating of the hospitals, but they were filming the corridors of the hospitals, and we know that no one gets treated in the corridors. And of course, obviously, the time of day as well, in the evening, in the midnight, there's not going to be anyone out in the, in the wards, outside anyways, that time.
Yeah, I think there was a video where they were filming on in Gloucester or somewhere, and they went to these kind of areas where things looked a bit quiet, and there were some clinic places closed off. But clinics, you don't do clinics the weekend for the most part. And if you're going to go on in the evening, they're not going to be clinics. And where there are patients who are sick, members of the public are not allowed to sort of just walk around willy-nilly, visiting areas temperature where you've got sick patients. So then, like you said, corridors are empty. That doesn't mean anything.
Yeah. Jazakallah khair. So just as a final word, just to finish off, do you have any general advice for the community and those who have been affected by the conspiracies and the rumours?
Yeah, my final word is this, that, ultimately, anything that happens, it happens with the permission of Allah, yeah? And I think conspiracy theories, looking at these, I've seen some of these, I've watched some of these videos, they have a paralyzing effect on people. You lose hope, you become fatalistic, you become pessimistic and passive, and ultimately Allah Ta'ala is in control. Allah is Ar-Rahman Ar-Rahim. There's a wisdom behind this. Inshallah, we should have sabr. The ones who've died, inshallah, they'll die as shaheed. The other ones who are suffering, inshallah, it's a kafara for us. And Allah will remove our sins. But Allah has sent a disease down, but He doesn't send it without sending a cure. And the vaccine is part of that process. Another part of the process is social distancing, washing hands, wearing masks, listening to the people in authority. So these are things that principles from Islam anyway. فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. Ask the people of knowledge if you don't know. And to throw back at all these anti-vaxxers and the COVIDiots and the hoaxers, I would say to them, قُلْ هَاتُوا بُرْهَانَكُمْ إِن كُنتُمْ صَادِقِينَ. So bring your proof, if you're truthful, because I can bring my proof. I have a huge amount of proof, from my own eyewitness testimony of hundreds of my colleagues, as well as, papers and statistics and stuff. So I think the Muslims should, Muslims are people of, inshallah, who use their aql and don't use their emotions. This is something real, and ultimately, we have to we have to use our intellect to combat this big trial from Allah. And inshallah, Allah Ta'ala will remove it one day. But I think, and more generally, I think as a Muslim community, we have to start looking at our own health. We have diabetes is rampant. People don't exercise enough. People get obese. The best thing that any individual can do to fight this, in my opinion, is to be physically fit. Because the youngest people who get ill tend to be overweight and unhealthy. So as an individual, if one was worried about this, I think it's important to take regular exercise, stop eating junk food, eat healthy, and look after yourself.
Dr. Mazhar, Jazakallah khairah. May Allah put your work on your record of good deeds and raise you by way of it. We appreciate you taking out your time to benefit us and the wider community. We'll end off here, inshallah, with some words and a thank you from our elder brother, Abu Hafsa Sufyan.
بسم الله الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه ومن والاه. يقول النبي صلى الله عليه وسلم: من لا يشكر الله لا يشكر الناس. Whoever does not thank Allah, he will not thank the people. And he says, صلى الله عليه وسلم: إنا أشكر الناس لله عز وجل. أشكرهم للناس. The most people who are thankful to Allah are those who are the most thankful to people. فأقول لأخي الكبير الفاضل الدكتور مظهر ولأخي الفاضل حيدر: جزاكم الله خيرا، وأسأل الله أن يجعل كل ما قدمتموه في ميزان حسناتكم. Allah subhanahu wa ta'ala reward you abundantly, and He may put everything that you've done in the scale, in the good scale, in the good deeds, in the scale of the day of judgment. In the day when neither wealth nor children will be of benefit except those who come before Allah subhanahu wa ta'ala with a pure heart, and they will be saved. فَجَزَاكُمُ اللَّهُ خَيْرًا. One hadith comes into mind, barakallahu fikum, famous hadith. And there's two narrations. One narration talk about a man and the other one talk about women. And both narrations are quite similar. They saved the dog because he was so thirsty, he was about to die of thirst. And they gave him water. And Allah subhanahu wa ta'ala has forgiven them because of that. Ahl al-Ilm, they said, if this is the reward, which is the total forgiveness of Allah to this woman and to this man for saving a life of a dog, of an animal. Imagine a person that saved a life of a human being, a life of a Muslim. Shaykh al-Islam ibn Taymiyyah rahmatullahi alayhi says, all this virtue of this reward that they both get, and especially he's talking about the woman, he said she got all this virtue and this reward قل ما حصل في قلبها من حسن النية والرحمة, because of what she had in her heart, good attention, sincerity and mercy. And he's the one sallallahu alayhi wa sallam who says, الراحمون يرحمهم الرحمن أرحموا من في الأرض يرحمكم من في السماء. Those who are merciful to others, Allah Azza wa Jalla will be merciful to them. Be merciful to those who are on this land, on this earth. And Allah, the one who is above heavens, will be merciful to you. فجزاكم الله خيرا for all the jobs that you've done, and for all the time that you spend with us to teach us, جزاكم الله خير, about this illness, so we can be wary and we can be careful, so we can save ourselves and we can save others بإذن الله تعالى. And the job, يا إخواني جزاكم الله خير, of medicine, it is one of the greatest science. Imam al-Dhahabi rahmatullahi alayhi says, I do not know any knowledge, any science after the science of the halal and the haram, i.e. the Islamic religion. It is more noble than the science of medicine. And then he says, except that the people of the book has beat us to it. So this is to prove the importance. So inshallah, all those brothers who are working flat out بفضله ومنه to help the community, you have our backup, and may Allah subhanahu wa ta'ala reward you. Likewise, jazakumullah khair, I don't want to be too long. I just want to remind a second point. One statement comes from a Shaykh Rabi' hafidhahullah, where he says, if there is in your speech that which is evil, and that which will cause harm, then safeguard your tongue from uttering it, and do not speak except with that which benefit the people. And this is the advice that I'm going to give to myself and all the community and all the people before they start posting things in general, let alone things regarding corona virus, COVID-19. Think twice, jazakumullah khair. Think twice, because you might be the cause, afana Allah wa iyyakum, behind the harm of other people. Be very, very careful. Be very, 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 very careful. You will be held responsible in the day of judgment. Be very careful. As a Muslim, we've been taught by Allah subhanahu wa ta'ala to verify the news. وَإِنْ جَاءَكُمْ فَاسِقٌ بِنَبَإٍ فَتَبَيَّنُوا وَفِي رِوَايَةٍ فَتَتَبَّتُوا. We need to verify. We need to verify the news. Likewise, Allah subhanahu wa ta'ala commanded us to ask the people of knowledge if we don't know. قَالَ فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. The people of dhikr are the people that are in hospital working flat out. The people that we trust from our community. The people we know, they are more than capable, walillahi alhamd, in their own field. I'm not going to go into this because the brother, hafidhahullah wa ra'ah, our dear brother Azhar, have answered all the questions regarding this matter. I just want the brothers to be very careful for everything that they post, for everything they said to others. Be very, very careful, because you will be held responsible. You will be held responsible for that. هذا والله تعالى أعلى وأعلم. وسبحانك اللهم بحمدك أشهد أن لا إله إلا أنت استغفرك وأتوب إليك. وسبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين.